Welcome back, viewers. We have been Dr. Salome, and you've heard how to brush your teeth and all that, the oral health. We heard about flossing. As we are going for break, we were listening about scaling. And this scaling, many people fear or are not aware. I don't even you, our viewer, you're not aware of scaling, and this is what doctor is trying to demystify. So kindly, now we reach a point where you're saying it's inexpensive, isn't it? So even in government hospitals, we have those services.
Yes, it's available, thankfully.
Yes.
Occasionally, you may find sometimes equipment can be broken down.
Yes.
That doesn't mean that you can't persist or persevere or hold on.
Yes.
But a number of government institutions have them,
Yes.
and we are happy as dentists that we are seeing things changing.
Sure.
That the services, which dental services are getting availed, dental personnel are getting employed. The numbers are being added a bit slowly. We'd like to see more.
Yes.
We'd like to see like every citizen
Yes.
registered with a dental practitioner so that they can be assisted in preventing these diseases.
Yes.
So that overall the cost of care, both man hours for the dentist,
Yes.
for you as a citizen, becomes manageable.
Sure.
Yeah, so that we can focus more on preventive. And as we were saying before, scaling and polishing, frequent checks, or even sometimes just polishing to clean the teeth can save you a lot of headache with other aids like what you've discussed,
Yes.
like flossing, interdental brushes for those who need them,
Yes.
those who have gaps. The younger people don't need, unless they've been afflicted by the diseases, they don't need much of the interdental brushes because they don't have spacing. Their gums are healthy, their
Sure.
bones are healthy, they are brushing well.
Ah.
Yes, so back to scaling. So a lot of people, we are actually aware, we are feared. I don't know why we are feared. And we shouldn't really be feared.
Yes.
So scaling, a few people have experienced sensitivity when
Yes.
the teeth are being
Exactly.
cleaned.
Yes.
Or they've said that's the hardest treatment they've had.
Yes.
But in professional hands, if you've actually visited a dentist, the dentist is trained.
Yes.
And I must point it out that we have quite a number of dentists, but we may also have people masquerading as dentists.
Really?
So
We have fake ones also.
it's
Do you say
possible.
fake or-
It's possible because of what is it called? I'm forgetting what it's called, where, like before we had traditional things that we used to do.
Sure. Yes. Yes.
So a few of those things still exist.
Yes.
But if you get scaled by a professional dentist, it should not be uncomfortable. A few people, nevertheless, experience sensitivity when the teeth are being cleaned.
Yes.
And if they do, like we said, there's something that can be sprayed around the teeth
Sure.
to reduce that sensitivity, and something applied thereafter.
Yes.
So, and also there are toothpastes. And since in the market we just have two, I can mention both of them.
Yes.
Yes, I've not been paid marketing fees, but in the interest of public knowledge, one can follow up after the dentist has done scaling.
Yes.
And your teeth are sensitive.
Yes.
You let them know, they apply something, it's called a desensitizer. There are many things the dentist will do. Yeah, because also you don't know, dentist wants to treat their patients and they don't feel like coming back.
Yes.
So that can be applied. And also the toothpaste, Sensodyne has various brands
Sure.
of toothpaste that are desensitizing.
Yes.
Colgate also has a type of toothpaste in the supermarket.
Yes.
All these are in the supermarket, so if you go to the toothpaste section, you'll find them.
Yes.
So those are the two companies producing desensitizing toothpaste,
sure.
at least the ones that I'm aware of as of now.
Yes.
But having said that, 99.99% of patients will have their teeth cleaned, scaled, polished, and they'll have no sensitivity. Yeah.
Now, Dr. thank you. We have in Fatuma.
Yes.
Fatuma is asking, there's many brands for toothpaste.
Yes.
And of late we have been the most famous about charcoal toothpaste. What is the doctor's take on charcoal toothpaste?
Well, it's not, I wouldn't say it's any superior to the other toothpastes.
Yes.
Maybe that's why what I would want to do, because we know who is producing what.
Yes.
What a customer should look for is a toothpaste
Yes.
that in our country that contains fluoride. Yes, and a toothpaste of a taste they like. The idea of the toothpaste is just to help in cleaning, the abrasive.
Yes.
All these other many words, herbal, they are marketing also tools. So what we need is a toothpaste that has fluoride. Because fluoride has a way of preventing cavities.
Yes.
And then the toothpaste will have abrasives to help in the scrubbing motion.
Yes.
That's all you require, and a taste you like.
So basically the work of fluoride is to prevent cavity.
Mostly it's to prevent cavities, and to a small extent it can help in the management of reducing how plaque accumulates.
Yes.
Yeah.
So maybe, Dr. you highlight on how often should somebody visit to go for dental checkup?
Yeah, that's a very good question,
Yes.
and thank you for that.
Yes.
And I really want to first go, if you allow me,
Yes.
to go to the people I see most, then I come to the adults.
Yes.
So for the people I see most, and this one I'm addressing the mothers especially, and the fathers, the parents.
Yes.
Mothers and fathers, they need to visit the dentist for the children as soon as the first tooth comes into the mouth. And that's around 6 months.
Yes.
And that way, and I'm happy currently, we are doing very well actually as a country in terms of trying to inform, but we have not reached there.
Sure.
Yeah, so we need to reach there because we have a big burden of dental disease in children.
Yes.
2-year-olds, the teeth are just coming in and they are all flat. The child has abscesses.
Yes.
Very distressing.
Yes.
And generally for the rest of the public,
Yes.
or for the rest of the people, the older people who take themselves now, they need to go to the dentist at least every 6 months.
Sure.
But if you are really good with your cleaning, you're not having any issues, once a year is good also. Yeah.
So basically, does insurances cater for that fee for all those services, dental services?
Yes.
Checkups and all that?
Yeah, we have lots of insurances that cover dental services.
Yes.
Unfortunately, very few comprehensively cover the cost of dental services.
Yes.
So the public is really exposed. So if you get a cover of, say, 10,000 per year or 20,000 for a family, if it's it doesn't really do you service. So they do, but very few do it comprehensively. They'll have many riders that we will not cover this, we will not cover cleaning, which is very important. Yeah, we will not cover a crown, that's a cap on a tooth, which they think it's cosmetic, but it's not cosmetic. So insurance covers, but it's far from adequate. So we hope going forward, as we have our National Hospital Fund, that it will be propped up to cater for dental, especially the preventive and promotive aspects. Yeah.
So on our social media, somebody is asking, Joseph Karaoke is asking, what causes tooth sensitivity?
Thank you, Joseph.
Yes.
There are many causes, but the commonest cause will be cavities. That holes on teeth. When you have, the tooth has been broken, the surface of the tooth has broken down, and you see something like it's like a cave.
Yes.
So holes are one of the commonest causes.
All this.
You can also have tooth sensitivity if like you've used either a mixture of two, either people who chew with a lot of force
Yes.
and brush with a very hard brush, very hard force, especially on the sides.
Yes.
Teeth can wear out at the gum line, just where the tooth goes into the gum.
Yes.
So that can also cause extreme sensitivity. If somebody is not brushing well,
Yes.
and the teeth are not, the tissues or the parts of the gum and bone, all
Yes.
that holds the teeth is not healthy. So the teeth are moving, there's big gaps between the tooth and the gum.
Yes.
One can also get sensitivity. Yes. And you can also get sensitivity if like you keep sipping acidic things.
Yes.
And even wearing, the teeth can even get worn out. Yeah.
Maybe, Dr. There are some foods and drinks you should avoid
Yeah.
that cause cavities and all that. Maybe you can highlight on that, please.
Yes. Thank you.
Yeah.
So the foods that will cause cavities are mainly that cause the greater damage.
Yeah.
Will be tea that contain sweets, sugars, and acids.
Yes.
Like sweets, cakes, biscuits, sodas. So these things should be taken in like moderation.
Yes.
Once in a while,
Right.
when there are parties.
Yes.
Because they also tend to have, they are manufactured, so they tend to have a lot of preservatives. So
Yes.
there's also a downside of the preservatives apart from causing cavities.
Yes.
Some people get like frequent sore throat because if they are frequently taking them.
Sure.
Yeah, so they need to be in moderation. Moderation means, say, especially for the young people, they get thirsty, so they drink a lot.
Yes.
So they need to make choices like, on this day or at this time, I'll take a soda, but don't take it every day. Yeah, it may not even be building much in terms of your health, but these things have been produced to be taken.
Yes.
But they need to be really controlled. So for the very young, like teenagers, university students, that age group, they need to avoid cakes, biscuits, sweets all the time because there's a lot of sugar and acids in the mouth. No more bacteria in the mouth will form acids, then you get cavities.
Sure.
For the very young children, mostly you'll find a child with a lollipop, and this dentist sometimes feels like stopping and pulling it out and throwing it away. Yeah, but so the continuous, like having persistent sources of sweet things in the mouth.
Yes.
Many intakes are what causes cavities, and it can be very destructive.
Yes.
Yeah.
But Dr. Maybe many patients, since you are dentist, you see children. Mostly it's where you are specializing at the moment. I believe children are the most vulnerable in terms of foods and drinks. They're taking chocolates and all that. How do you advise the parents about that? Because when they are going home, they have to carry some we call it them candy and biscuits and all that.
Yeah,
and because of the love and attachment to the children.
And sometimes
it's
when
not
you've
easy.
been an absent parent,
Yes.
maybe you've been working
Yes.
around the clock, not seeing your children for a week,
Yes.
traveling. Yeah, so children are very vulnerable, and they also have their teeth are not as hard,
Yes.
especially before the first set of the teeth. And the first permanent teeth at the back, they
Yes.
come in very early when children are not able to brush well.
Yes.
And the greatest number of people that are suffering this are the ones from low socioeconomic backgrounds.
Sure. Yes. Yes.
Because there it's easy you try to look for something to fill the child's stomach.
Yes.
Which is the mother is trying to do something.
Sure.
But sometimes, of course, it's out of ignorance.
Yes.
No, that I mean, not knowing. Not that they've refused, it's just that they don't know these things will cause. So they'll find a child with a very huge lollipop, it's cheap.
Yes.
The cakes and the biscuits that will be bought and sweets are very cheap.
Sure.
And they are all over. So parents have to make a real, what do I say, go out of their way to
Yes.
make informed choices and decisions.
Yes.
because you could substitute the same things for fruits, which are healthier
Yes, yes.
and cause cavities less. Others give a child a bottle of sweet things,
Yes.
like the drinks in the small bottles, or even milk with sugar,
Sure.
to stay in their mouth for long hours,
Yes.
especially when they sleep, so that they don't disturb. And that also doesn't work well, so they need substitutes.
Yes.
So yeah, they are at risk, but the good report is for the ones that can afford, that's the parents who are like middle class to upper class.
Yes.
We have very informed parents,
Yes.
and it just takes discipline. Yeah, and the children learn. Children are very smart.
Sure.
They actually learn this one. We only take it when there are parties. This one we only take it on a Saturday, and they will be ready for that.
Yes.
But there's also this, the one of a child is passing around an aisle at the supermarket. They don't know their limits.
Yes.
They'll pick, they'll insist. Yeah, so parenting skills when it comes to preventing, they need
Sure, yes.
to be up, but there are quite a number of children you'll find not a single cavity.
Yes.
And also the discipline of reminding the children to brush.
Yes.
And if the parents have good teeth, more often the children will have good teeth.
Yes.
Yeah. But there's also this thing of giving your child what you never got, that generation. Maybe that was our generation. I think the current one, things are all over, it's freestyle. So that's, I think, what is contributing to the large number. We have like, in every 2 children you'll meet, one will have lots of cavities. Yeah, which is, it's painful, distressing. Yeah.
Wow. Viewers, I hope you're seated there and glued in getting this information from our dentist. When we come back, we're going to talk about why we have bad breath. You will come to learn about braces. Don't touch that remote control. Right now, touch your phone. SMS 21144. Thank you.